hurt yourselves. Okay. All right. Welcome to the October 21st meeting of Broadwater County Board of Health. We can start off today. I want to call the meeting to order, and then we can take public comment for any items that are not on the agenda.
I just have a small announcement for Billings Clinic Broadwater. We are working in conjunction with Sim Montana on Friday to have a mental health community awareness drill. So if anybody's interested in participating, I will send the link out. And it's from 9 to 4 on this Friday.
Awesome. Thank you. Any other public comment for items that are not on the agenda? Anybody? All right. Okay, first agenda item. Karen, gosh, I'm sorry. Karen McCain from Lewis and Clark Public Health Department. Update on programs that are serving Broadwater County.
Yeah, thank you so much.
Yeah.
All right, is this?
It is. Yeah.
Okay. All right, yes.
Can you state and spell your name?
Absolutely. So my name is Karen McClain. It's C-A-R-I-N, and my last name is McClain, M-C-C-L-A-I-N. And I'm with Lewis and Clark Public Health, and we were excited to meet with you all today to just remind you of some of the programs that we have that serve Broadwater County. And so the program that I run is tobacco prevention and cessation, and so I'm also that point of contact for Broadwater. So just a kind of high-level overview is part of my work involves promoting the different quit lines that we have in Montana, and we're really lucky to have multiple types of quit lines. So those include kind of our general quit line. We also have a quit line made for pregnant women, and that actually has a cash incentive that goes along with it. If you complete 5 coaching calls, you can get up to $200.
Is it for smoking or is it for
smoking?
Tobacco?
Yep.
It's okay.
And then, in addition, there's an American Indian quit line, which we think is really important since we know that there's cultural significance around tobacco in their culture. And so we try to make the distinction between tobacco and commercial tobacco. And then there's also a youth quit line, which we're really working to promote, especially with kind of the rise of vaping that we've seen, at least in Lewis and Clark County. I don't know if you guys are seeing that here. So the cool thing about this quit line is you can call or text. We know that young folks don't always want to get on the phone and talk on the phone. And the other cool part about this is that in Montana, it's confidential. So in other states, if you were to reach out to the youth quit line, your parents might get a letter, or there might be some kind of follow-up that would, reveal that you have been reaching out to the quit line. That's not the case in Montana. And I brought materials for these programs that I want to leave with you. And if there's anything that you want more information about or you have questions, I'm also leaving my business cards. You can reach out to me. Another aspect of my work is provider outreach. And so often when we come to Townsend, which we do regularly for the Broadwater County Social Services Committee meeting, we will stop by Billings Clinic, we'll stop by St. Pete's, the dentist, who's just a lovely person, and make sure that they have the information they need to refer people to the quit line. And just confirm that they're kind of screening for tobacco use in the work that they do with patients. One other thing that's really kind of the main focus of our work is youth engagement, and we know that that's really important. That can look a ton of different ways. One thing that we see great engagement with is the REACT Coalition, which is a group, it's like a youth-led group in the schools. Jill Flynn told me that there used to be a group here, a REACT group here, and it's really cool because it's kids advocating for, not using tobacco and being really good ambassadors to their fellow students. We also have days of action like Red Ribbon Week, through with CHEW. We have all these kind of national days of action. And we're really looking there to have student-led outreach, right? So like ideally, we would have a student group that's interested, let's say like a React group, they wanted to do that. And then I would be a point of contact for them with questions. I could also apply for mini grants on their behalf, things like that. But again, we know that when you hear from your peers, that's much more convincing than hearing from an adult that you've never met before, right? So, and we've done stuff before, like participated in Strong as a Bulldog, that event, which I think is before prom here. And that's something we want to continue to do. Another aspect is we do signage. So like if any of the government buildings or the businesses or the schools need signage, I get that from the state and then I can give it to you. So if you want to replace signage, or also the parks, if you want to replace signage, you want to, sometimes it gets faded or, peels off or whatever, or you want new signage, I'm your gal. So I hope you'll reach out to me and I hope you'll share that with other folks. So that's kind of the tobacco program high overview. I also wanted to touch base on a few other things that serve Broadwater County. And I'm going to leave you a card for each of these programs, so you have that. One is our cancer screening program, and that's led by Melissa Baker, who works at Lewis and Clark Public Health, and she's been in that role for 17 years, so she's something she's really passionate about and committed to. And so that coordinates screening for breast and cervical cancer for those who are underinsured or uninsured. And so she works really hard to connect people with, we don't do the screening in our office, but we connect them with St. Pete's or Billings Clinic or wherever. Again, one of the counties that we serve for that program is Broadwater. We also serve Jefferson and Powell and Marr and Lewis and Clark. Next is the WIC program, which we are working with in collaboration with Ruby at the local health department. She's very generously offered to open up her clinic space for our WIC staff to come out once a month and hold, and meet with people. I just need to grab my water. I'm sorry.
That's all right.
I should have brought it up here. All right, much better. And so WIC, if you're not familiar with it, is Women, Infants, and Children. It's a really important program that we know helps lots of families. And Mary Sparks is the contact for that program, and I have her information as well. And then the last thing I wanted to touch on before I pass it off to Rachel, my colleague, is the behavioral health systems improvement work that we're doing in collaboration with Broadwater County Public Health. One of my colleagues, Jolene Jennings, will be out here on Thursday, I think in this very room, working with Megan Poe on an MCRT, which is Mobile Crisis Response Team, kind of strategic planning. So when I let Drenda know, our health officer, that I was coming out here, she said, I'd just please pass along the message that we're here. We really want to collaborate with you. We want to share resources. We want to take the lead from you and what you think your community needs. And yes, I think that's what I wanted to tell you. Are there any questions that you have for me before I pass it to Rachel? I know that was kind of a quick overview.
I do have one question for
Yeah.
you. With the quit lines,
Yeah.
There's a lot of quit lines.
Yes.
So is there like one main quit line that someone
Yes.
can call, and if they're like, hey, I'm a pregnant woman,
Absolutely.
that comes out in the conversation,
Very good
they'll
question,
get-
because you don't want people to have like an extra step of like, am I
Right,
calling?
like which quit line do I
Yes.
call?
Yeah, so I have some information for you, and they will direct you to the right place. Yep.
I will probably pass on materials that you give us to Ruby.
Awesome.
To distribute and whatnot. She couldn't be here today. She had something come up. So
Yeah. Okay.
Yeah, I can pass that on for you.
Awesome.
Yeah.
All right, well, I'm going to pass it off to Rachel Jeffrey. She joined our team recently, and we're really excited that she's on our team, so I'll let her introduce herself.
Thank you.
Hello,
Hi.
I am Rachel Jeffries.
Can you spell your name?
Yes, Rachel Jefffereries. I am the new suicide prevention coordinator at Lewis and Clark County Public Health. I've been in this role a couple of weeks, so I'm getting up to speed on what we offer. I'm currently getting certified in QPR, which is a suicide prevention training, and trying to recruit more trainers and get to meet the trainers that we currently have. I did bring information about another role adjacent to mine. It is open. They're trying to fill it, but there is the opioid misuse prevention and Safer Communities Montana coordinator position, and that's open. They're trying to fill it, but I did bring some Deterra, which is a way to dispose of medication safely. So pop it in the bag, it's deactivated, and then it can be put in the garbage. And then I also brought some gun locks as well.
Okay.
I'm pretty green and still figuring everything out, but if you have any questions, I can write them down and get answers for you.
Okay. Thank you. No, it's good to know that these programs are here. We've had a lot of discussion around behavioral health,
Sure.
whatnot here. So there's some different things going on, but yeah, it would be great. I can take anything again. I can pass it on to Ruby.
Okay, thank you so much. I appreciate it.
Thank you. You guys have anything? No? Anybody else? All right. Thank you, ladies. Appreciate your time. All right. Next on the agenda, we have Ruby Taylor, Public Health Director, Broadwater County Public Health Department, Board of Health Training with Montana State DPHHS. Ruby was unable to come kind of last minute, so she passed on to me just some of her main points. At the state level, the Board of Health training program is being updated, so we're going to have to wait until spring to do that training, and she thinks it's about 1.5 hours approximately. They really go over what the scope of the Board of Health is, what we can do, and just how we can assist as well with certain things like policy updates, which I know is something that Ruby needs help with, and I think we can get after that a little bit after the training in the spring, so that's just going to come down the pipeline. She's very busy with flu clinics right now. And she has the new COVID vaccine, but there doesn't seem to be a lot of cases. She said people are not testing really like they used to and reporting it, and so they're not getting notified of the cases through the state, which I think is that Midas? It's the state, I think.
Yeah.
Yeah. So really, COVID is, I think, kind of. I think people are just not reporting because it's being treated like a flu in many ways. She did speak with Doc Campbell, who is our current medical director and, for the public health medical director, and he is good with coming up with a succession plan, but he is not interested in retiring at this time. So she is considering maybe an MOU with the hospital to explore that succession plan for a medical director. Yeah, so that was her updates. Any thoughts, questions on that? Anyone? Nope. All right. Last but definitely not least, we have Megan Bullock, Broadwater County Sanitarian, Broadwater County Environmental Health Department, and updates on the Connor Knapp property.
Okay, good afternoon, Madam Chair and members of the board. I have an update on activities in the environmental health.
Thank you.
It's already outdated. I fixed it multiple times today and then finally decided to save a tree. So 28 septic permits have been issued. We're now at 101 as of today for 2024 compared to 94 in all of 23. Been busy inspecting septic systems, evaluating properties. As far as licensed establishments, I have 7 left to do before the end of 2024, 4 of which I have scheduled for near future, so making good progress there. Lots of temporary food permits have been issued. That was mainly because of Fall Fest and the fair. Lots of surveys being reviewed, lots of DEQ subdivisions reviewed. Probably the most exciting news is that as of 10 minutes ago, I figured out how to get some data off equipment. Last meeting, we brought to the board that there are hundreds of files that are incomplete. You allowed us to get a stamp and go through them and try to get some of them into the system. We were trying to estimate how many we were able to do. I would say at least half, if not more. The others we were not able to, but now with the new development, it'll be a lot of work, but we should be able to whittle that down even more.
What's the device called again?
It's a Trimble. GPS. Ken, the IT guy, checked to see what it would cost to have a professional person retrieve them, and it's thousands and thousands of dollars. So Daly and I will work and try to get that information.
Good job on getting
so I'm
that
excited
figured
about
out.
that. One of our violations was the Egg Covenant property NAP in Duck Creek, and I'm happy to report that that application was submitted to DEQ the 11th of October, so
Nice.
any day now I expect to get an approval. I'm surprised they're usually back quicker. But once that happens, then he can go through the subdivision review, and the governing body, the commission, will hopefully lift that Egg Covenant. We'll get him into compliance.
Were you working on that one, JJ? You were helping.
Yes.
You were helping with that one.
Mhm.
Okay.
Yep, so it turned out good. I'm sure it'll go through. It's just, usually it's a week to 10 days, so we're right at that time. So expect to see that any day. Otherwise, sending out, seems like a fair amount of violations, either people building without a permit, or maybe, what else? Having lots of RVs parked on their property. Just that type of complaints.
Just worried that they're using the dump, like just one, like all the RVs are dumping, right?
Right, that
Okay.
they're overusing their septic system, overloading it. Other than that, does anybody have any questions?
Do you know how long, and I'm curious, I knew they changed the licensing for the food trucks and whatnot in the city. Do you have any idea what that is now, what they pay to do that? Because they have to come in, but they also have to get a permit from you, right?
Right, so I don't know what the city does,
Okay.
if they require a separate license, but under mine, it's really confusing. In the last legislative session, or it might have been the one prior, we used to have what was called a cottage food certification, and that was for your people that are making home-baked items that are not potentially hazardous. So if they don't require refrigeration, they're okay. Then the legislature passed a new rule called the Montana Local Food Choice Act, and under that one, potentially hazardous is no longer a thing. They just can't. It's the craziest rule. You can cook pretty much anything. It has to be out of your home kitchen, and it has to be face-to-face sales and associated with a traditional community event. So your Montana Local Food Choice people could do farmers markets, Fall Fest, Fair Rodeo, any traditional community event. Here's the crazy part, is that they can do anything, but they can't use meat. But they can use chicken. If they raise,
Chicken not meat? Is chicken not meat?
so if you raise your own chickens, they
gosh.
have what's called 1,000 bird exemption. And if you don't do more than 1,000 birds, you could literally butcher your own chickens, make chicken enchiladas, and sell them at farmers market and not need a license. And so it's really become difficult trying to figure out who, and then of course your civic groups, they don't have to pay a license. They're still expected to follow all the rules. So we finally came up with an application that we have our mobile food that are licensed, We have our nonprofits that are exempt from licensing. We have our cottage food. We have our Local Food Choice Act. And just trying to figure out who needs to pay, if their food meets the rules. It is
goodness.
really confusing. And in the name of food safety, it doesn't make sense at all.
Well, especially not chicken.
Right,
No.
the chicken thing baffles me. You almost need like a little infographic that's like these and this.
It's super,
that's
super
crazy.
confusing, especially chicken, because it's such a nasty, I mean, there's so many nasty
Yard
things that-
bird.
Yes.
Yeah.
So,
I like chicken, but
and then to tell you that you have to cook it in your own kitchen. I mean, people do want to go like to a school or somewhere where it's a licensed facility, but that's the rule. It has to be done in your home kitchen.
because if they cook it in a licensed facility, does it put them in like another class of?
Yeah, if you do that, now you're a licensed facility too,
Right.
and you can sell wherever you want.
Oh my gosh.
Yeah, it is quite confusing, so.
Okay.
Now, I understood from somebody that maybe the city or whomever does the farmer's market, maybe they don't allow local food choice unless they're from Broadwater County, is kind of what I got. The way I do it is I have everybody fill out the form, and the reason for that is that I know who's there, I know what foods they have. If we happen to have a foodborne illness, we at least have somewhere to start.
Wow.
So
Okay.
I think they're getting used to that. Everybody knows they have to fill out a form.
Because that's pretty much anything. You can cook pretty much anything at that point.
Yeah.
Yeah.
Doesn't make a whole lot of sense,
I
but
mean, I don't know. I'm not the expert, but it seems like chicken and pork would be like two of the more stringently monitored ones. But
yeah, so no game animals, no beef, no pork, but you can have chicken if you butcher your own.
okay. And my only other question was, what are the violations that you were talking
Oh,
about?
these ones, let me see if I can remember. So the way I do it is I don't go knock on doors. That's not a super wise idea. So I usually fire a letter out. So for example, there's a house being built out of town here, and I keep driving by and wasn't finding they had a septic permit, and the regulations say you have to have a permit prior to doing any construction, well drilling included. And I wasn't really sure whose property it was on, so I did fire a letter out. Unfortunately, I got the wrong property. It's just a very small triangle.
Oh,
And as it turned out, that one did have a permit way back in
Oh, okay.
2018, so I did find it. But that's often what it is, that or that somebody's building a second dwelling and doesn't have a permit for it.
okay.
How long is that permit good for? Sorry.
They're usually written for a year. We do extend them if need be at no cost.
So do they come to you for that permit prior to building or putting in the well, anything? Or do they do that in conjunction with you?
They're supposed to, but a lot of them, I'm going out there and the house is already built. So there's a huge risk there. They may have built the house the only place the septic can go.
So these are specific septic permits, okay?
Yeah, 'cause
Because we don't have
well
building
permits.
permits, and we
No,
don't do well
No building
permits.
permits, no well permits, but the
Okay.
regs are specific that you have to have the permit
Septic.
prior to doing any
Okay.
construction. I did talk to, of course, any letter I send out, I run it through the county attorney's office first. And Kaylin suggested that maybe we look at letting people know that. So we were just discussing it today, maybe
Okay.
how to put it on the website so people realize they need that permit first.
Okay.
I think that's about it. Things are starting to feel like they're slowing down a little, but I fear that there's going to be another rush, the first snow, because everybody's waiting to put septics in. JJ knows how that goes.
Uh-huh.
Panic moment. in this whole place.
Right, well, I'm glad we got the Knapp property resolved. 'cause
Yes.
That was, I know the 15th was the deadline for that, so we were gonna
Yes.
talk about that today, and I am glad it got worked out, so thank you
Yeah.
for your time
Yep.
and work on that.
Moving
And
forward.
JJ, thank you. So, I don't have anything else on the agenda. Does anybody else have anything they wanna bring up? Any thoughts, concerns, JJ?
I don't know if I have any. Talked to Megan a lot, so.
And Dwight didn't pass on anything, so. Anybody else? Ladies, thank you so much for coming.
Thank you for having us.
All right, we can adjourn. 3 what?
27?
27.